when a person becomes morbidly obese, it turns out that nothing seems to work so that the person will lose substantial weight and keep the weight off year after year. Nothing seems to work. The only thing that does work happens to be weight loss surgery. And weight loss surgery is not new. It's actually been around since the 1950s. But a lot of the early weight loss surgeries, which were called intestinal bypass procedures, a lot of those patients died and a lot of those patients had bad complications. So from the very beginning, weight loss surgery had a pretty bad reputation. Now, the first operation that came along that was a fairly good operation and it could be done fairly safely was the vertical banded gastroplasty, and most people know that because it's also called the stomach stapling. And the stomach stapling has been around since the 1960s. When you do a stomach stapling, what you're doing is you're making a very small pouch at the very top of the stomach. And once you have a very small pouch, then a person can only eat a small amount of food. The pouch gets full, the person feels full, and the person stops eating. And that's exactly how the stomach stapling works. It's called a restrictive procedure. Now, a lot of people did lose weight after stomach stapling, but the problem was a lot of things could happen, and the bottom line is a lot of people gained their weight back after stomach stapling. Nowadays, it's very rare to find any surgeon in America who would do a stomach stapling for one very simple reason. There are far better operations.